morning. I'm gonna teach you how to do CPR. So, CPR. What does CPR stand for? So, C is for cardio, meaning heart. P, pulmonary, meaning lungs. And R, resuscitation, which is revive. So, first, definition. CPR, cardiopulmonary resuscitation, is the manual application of chest compression and ventilation to patients in cardiac arrest, done with an effort to maintain viability. Indication: road traffic, drowning, electric shock, airway obstruction, cardiac arrest. Contraindication: do not resuscitate or DNR. Chain of survival: early recognition and call for help to prevent cardiac arrest. Early CPR, by time, early defibrill to restart the heart. Post-resuscitation care to restore quality of life. CPR is easy as CAB. C stands for compression. So, you push hard and fast on the center of the victim's chest. And A is for airway. So, there are techniques on how to check the airway. So, we're going to use the head tilt chin lip to check the airway. And B stands for breathing, which is give mouth-to-mouth rescue breaths. Positioning our patient for CPR. CPR is easily and effectively performed by laying the patient on supine position relatively on a hard surface. So, which allows effective compressions of the sternum. Delivery of CPR on a mattress or other soft material is generally less effective. Kaya mo bounce man siya, so ineffective among compression. So, the person giving compression should be positioned high enough above the patient to achieve sufficient leverage so that he or she can use body weight to adequately compress the chest. So, remember to spell CAB. So, compression, restore blood circulation. So, our first thing to do is to place the head of the one hand on the center of the person's chest between the nipples. Place other hand of the first hand. Keep elbows straight and position shoulders directly above hands. Second, use upper body weight, not just arms, as pushing straight down and press the chest. So, mo ni ang example sa positioning sa imong sa o ang patient. So, compression rate. Pila man tamo pila ka minutes o pila ka unsa ka depth. So, in adult victims of cardiac arrest, it is reasonable for rescuer to perform chest compression at a rate of 100 to 120 per minute. So, compression depth. During manual CPR, rescuers should perform chest compression to a depth of at least 2 inches or 5 centimeters for the average adult while avoiding excessive chest compression depths greater than 2.4 inches, 6 cm. Okay, kung too much depth would cause failed chest. So, imbis nga mutabang ta sa patient, makapuno na ta sa iyang damage. So, chest recall. It is reasonable for rescuers to avoid leaning on the chest between compression to allow full chest wall recoil for adult and cardiac arrest. If not trained in CPR, continue chest compression until there are signs of arrest. If not trained in CPR, continue chest compression until there are signs of movement or until emergency medical personnel take over. So, mo ni ang atong positioning kung mag-chest compression ita. Second is sa atong saving method is airway. So, open the airway. So, some signs of obstructive airway include poor air exchange, high pitch noise while breathing, and ability to speak. If rescuer trained in CPR and perform 30 chest compression, open the person's airway using the head tilt chin lift maneuver. So mao di atong gisulti kanina nga head tilt chin lift maneuver. Put palm on the person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward to open the airway. So next is atong breathing sa AB method. So breathe for the person. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or cannot be opened. With the airway open using head to shoulder maneuver, pinch the nostrils shut from mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. So prepare to give 2 rescue breaths. Give the first rescue breath lasting 1. So, mani ang tong gikuan ganina sa pag-head tilt chin lift ng patient, then atong i-pinch iyang nostril, no close sa nose, then i-cover up na to iyang mouth sa atong mouth para sakto ang oxygen na to mahatag. So continue. It may be reasonable for the provider to deliver 1 breath every 6 seconds while continuous chest compression are being performed during CPR with advanced airway. So the adequacy of breath given can be determined by observing for rise and victim's chest. So atong during maghatag-tag rescue breath, so atong tanaw ang rise and fall sa sa victim's chest kung effective ang atong paghatag sa breathing. So continue CPR until there are signs of movement or emergency medical personnel take over. So recovery position. If naka-recover ng position, would go to lateral position, recommend lateral or 3/4 prone position of the body. If a person is unconscious but is breathing and has no other life-threatening conditions, this should be placed in the recovery position. Putting someone in the recovery position would keep their airway clear and open. So lateral recumbent or sa side position. It also ensures that any vomit or fluid won't cause them to choke. So mao ni ang atong position, so sa lateral recumbent position. Ang iyang hand over the chin to keep open the mouth, then ang arm bent to prevent rolling, then leg bent to support position. Pero dili siya malamba. Conclusion. Cardiopulmonary arrest is a loss of airway, breathing, or meaningful circulation. Cardiopulmonary resuscitation is the use of therapeutic intervention, primarily BLS, that are designed to restore spontaneous circulation following cardiac or pulmonary arrest. So, mo ni atong demo. Before you begin, mo ni atong mga steps. Immediately upon seeing the victim before starting CPR, ato i-check if ang environment is safe, is the patient is conscious or unconscious. If the person appears unconscious, mo siyang i-tap or shake sa iyang shoulder and ask loudly, "Are you okay, sir? Are you okay, ma'am?" Then check carotid pulse for 10 seconds. So if the person doesn't respond and 2 people are available, have the other person call for rescue or the other local emergency person to begin with CPR. So if alone, og immediate ikaw raw sa access no telephone, call Ritso o emergency hotline, then begins CPR. So as soon as the person moabot na mohatag na ta CPR, so kneel next to the person's neck and shoulder. So after right away hatag din ta sa atong CAB method. So C compression, started tag compression, then airway, check na to ang iyang airway, then breathe. So atong compression is 30 compressions, then 2 breaths. So good na for 1 minute, 5 cycles. So that's all. Thank you.